got something to tell you guys. Have you ever been to the ER and then got an itemized bill to see what they charged you for your ER visit? Well, let me give you an example. I sent a patient last week to the ER because he was in AFib, and I wanted to make sure he wasn't going to throw any blood clots, wanted to make sure he would cardiovert and all that kind of stuff, so he went and got checked out. Well, then he emailed me his itemized bill, and I was like, what the heck? I couldn't believe what they were charging, so I'm about to show y'all. FYI, he gave me permission to show the bill, but I did block out his name, so you won't be able to see that. And then also, he does not have insurance, so he's a self-pay patient. So let me show you what he showed me. Okay, so this is the bill that he gave me. And as you can see, I'm going to look at it from down here because I could not read that little picture. And you may have to pause so that you can see it. Let's see if I can make it bigger. Oh, yeah. Well, oh my goodness. That is ridiculous. I wish it would go back. Come on. All right, there we go. I'll just leave it like that. All right, sorry. You'll just have to pause it and look at it. But anyway, they billed him for his ER visit. He did not get admitted to the hospital. He just went in there and then he got discharged a few hours later. $9,274. Okay? Well, when he told them that he was a self-pay patient, they discounted $7,048, so he only owed $2,225. But, I mean, seriously, they charged him $9,200. Well, let's talk about what cost $9,000 for a little ER visit for AFib. All right, so here's the itemized bill. Look at his EKG. They charged him, looks like he had 2 EKGs. Each of them were $435. So he paid, well, no, he was charged $870 for those 2 EKGs. You want to know how much money I charge for an EKG? Let me look. Hold on, it's going to be on this side. EKG, $15. I charge $15 in my DPC clinic for an EKG. They charged him $435. All right, look at the lab section. A CMP, that is your liver function test, your kidney function, your glucose level, and some electrolytes. That lab was $900. Y'all, I charge $4 for that same lab. $4. They charged him $279 for a magnesium level. Just magnesium. I charged $3. CBC, that one was $178. I charged $3. Do you see the trend here? This is ridiculous what they're charging. A troponin level to make sure, of course, that he doesn't have any cardiac inflammation or something. $334 for a troponin level. Now, is my troponin level on here? Yes. My troponin level is $30. That's kind of an expensive one, but it's one that you need back fast. So maybe that's why it's a little bit more expensive. But seriously, $334 for troponin level. And then he got a chest x-ray, $416. I can send people up the street to the imaging center, which is about 20 minutes from my clinic, and they pay $75. It was $416. So basically, that's why this bill went all the way up to $9,000 something. But then when they found out he was self-pay, they wrote off the $7,000, and then he only had $2,000 bill left. So basically, if you had insurance and you went in there and you're like, oh, I have insurance, but you had a really high deductible, now the hospital is going to have a contract with your insurance company so that that $9,000 cost is going to be discounted. But let's say it's only discounted 50%. That's still going to leave you like a $4,500 bill. So you're still going to be better off if you didn't have insurance at all, $2,200. You might as well just get an emergency plan in case you have cancer, in case you have a car accident, or you have a heart attack or something like that that's going to rack up a big, huge bill, then that makes sense to have insurance for that. But otherwise, to have insurance just to go into the ER or just your primary care makes no sense. Let me show you what all my lab costs are. Hold on. Okay, so this is my little sheet that has my prices on my labs. The back side has other things, but I'm just showing you labs. So you can blow this up. You can look and see what the prices are of what I charge for, hormone panel, CBC, CMP, lipid panel, TSH. You can see what I charge for an anemia panel. These are the cheapest labs because this is what LabCorp charges me. And since you're paying a membership, I'm not really looking to make an exorbitant amount of money off of the lab. So I just charge what the lab charges me. And then I get a $10 venipuncture. So I guess I kind of make $10 off of it because I do charge the venipuncture because we have to use that money to pay for the lab supplies and stuff like that. But you can see how much money you'll save if you just switched over to a DPC clinic. So isn't that just the craziest thing that it costs that much? It's highway robbery. It's nothing but a scam. So if you have any questions, feel free to post them in the comments. I'll be happy to answer.